Hey, everybody. I am so excited to share with you today some really exciting news. It was a difficult morning. I had to say goodbye to a client, not meaning that we broke up for bad reasons, but because they were ready. And I wanted to share why it is so very important to me that I take data with every single one of my clients. First off, I have to say that the data, the assessments, yes, I use this to help with diagnosis, but more than that, it helps me to keep you accountable to your goals. It helps me to remind you of the hard work you're doing, and it keeps me accountable as a therapist. If I don't see an improvement with your assessment results, then that's an indication that something I'm doing is not clicking. Maybe you're not engaged in the process and we need to push the pause button. Maybe we need to come together and figure out what we need to do differently. But assessments are so very important. And I think so often in this field, it is so very subjective. I can't tell you how many times I have sat on my own therapist couches over the years and wondered, why am I sitting here? What's the difference? How do I know I've improved? Well, assessments can be that. So it's not just this subjective reality of, well, I subjectively feel better today, or I subjectively think that my client's doing better. No, I can prove it, because here's the problem with subjectivity is that we are going to have bad days. We are going to be doing the hard work in therapy, and ultimately our distorted thinking is going to come back into the mix and say, see, you're not fixed. You've still screwed up. You're no better. You're still the broken human being. But listen, that's not true. And that is why it is so very important for me to maintain assessment results. So I wanted to share today some results with this client that's graduating. It was such a hard conversation. They've been with me since the very, very earliest stages. In fact, they came to me as an internship student. Who wants to see an internship student? I'm telling you, I had so many people walk away and say, I don't want somebody that green. But this person, they stayed with me. They trusted me with the process. So I want to show you these results. I didn't have great results because I was with different agencies. So you can see the results were a little bit better in 2023 and 24 for this year, but they've stayed with me this whole time. So I want to show you, this is the PCL5, which actually shows us if there's an indication for post-traumatic stress disorder. This individual actually came to me with a very complex history of trauma. So it's something that we call complex PTSD. No, it's not in the DSM, but it should be. So this was a very difficult case in that it wasn't one traumatic event. It was a lifetime of traumatic events that then turned into physiological pain and suffering, all of the things. So it was a difficult process. So you can see at the peak, she had a peak score, I just said it, of 67 to 68. So that's about 85% of a peak score at 80 on the PCL5. So 85% is pretty high. So when this individual came to me at these high levels, we were seeing a lot of physiological issues. So we were seeing what we called her flare-ups. We were seeing a lot of pain, a lot of GI distress, a lot of migraines, a lot of just inability to manage emotions, manage day-to-day living. It was a really painful time. So really high levels. During this first year of time with me, again, I was still studying and learning. Do I want to go into trauma therapy? Where are my best fit? So I went through my own training. I worked under somebody that gave me some training. She gave me a certification, and it was just a wonderful process that really solidified this is the work that I want to do. So then I moved to a different agency, and that is when I began to say to this individual, I think it's time for us to step into prolonged exposure. So in my field, prolonged exposure, it's very effective with managing PTSD, with reducing our PTSD symptoms. You might hear of EMDR these days. It's very effective as well. Prolonged exposure is not fun, and somebody has to have full buy-in, because essentially what they're doing is they're coming to session with me and they're recalling their horrors that have happened to them over and over and over again in session. And then I record it, and then I ask them to expose themselves in between sessions. So really, who the heck would sign up to do that? But this person did, because it works. So you can see we started our prolonged exposure sessions in April of 2023, and look at that massive dive down. It is incredible. This is why it works. This is why I take the data. So you can see that this person went from 85 to 67.5 to 37.5% rate. You have to have a score of 30 to 31 to even be a positive screen for PTSD. She's right there. She's almost done. She had a screen of 30. And so finally, I said this last year, I said, you know what, this last month, I said, I think it's time that we do another evaluation because I noticed a shift in our conversations. It was a shift to more kind of everyday things. It was a shift to frustrations, but there was no longer this heightened anxiety, this heightened pain and traumatic response. And as an ethical counselor, I have to say, you've done the work. You don't need me anymore. Now, believe me, I'm going to miss this person. I really am. But it is unethical for me to keep you on board when I reassess you and you don't even screen positive. This person, I had this conversation. We were talking about the difference between anxiety, naming a feeling rather than labeling ourselves as a feeling. And I said, you are not that feeling because I've got the data to prove to you. That's those old distorted thoughts that are coming and rushing at you. They are not true. Let me prove it to you. So this is why it is so important for me to assess my clients over and over again, because too often we believe the lies that our brain tells us and it's just not true. And today was really tough. Today was really tough to say goodbye to someone that I've created a relationship that's really meant the world to me, that's walked with me through my own training. And it was tough. But the flip side, this is what it looks like for someone doing the hard work. This is what it looks like when someone says, I'm done with this trauma. I trust you, Piper, and I'm going to step into it. It's incredible. It's incredible. So if you're wondering why you're not getting better and you need help, if you're ready to step in it, fully step in it, I can guarantee you that you will see the same kind of results. You have to be ready, you have to be willing, and you have to be motivated to step into the grossness because it is, and it's painful, and it's so hard. But this is what it can look like for you too. You can look like coming into my office and you're just broken and in so much pain, and you don't think that there's any relief in sight. But you do the hard work and you can walk out going, I don't need Piper anymore.